So we're looking here at entry-level roles. So you want to get into a care role, but you're not quite sure how to do it or where to start. But the important thing is to remember that employing organisations will have individual requirements with regard to qualifications and experience. So if you want to work in a specific role, identify organisations you may wish to seek work with and make contact with them to see what you need in order to apply for a position. The NHS career site has lots and lots of information to help you find out what you need if you're unsure of which part of the sector you'd like to enter. So care workers and support workers, they both provide assistance to people with daily living, but the roles have key difference. Care workers often perform tasks for a person, while support workers undertake tasks with a person to foster and promote independence. You may be out shopping and you may see a support worker with a client taking them shopping and helping them to learn how to become more independent. They may take them to the GP for an appointment or to the dentist for an appointment. So that type of thing. Care or personal assistants usually focus on personal care, like bathing and dressing, in settings such as care or residential home settings, or even the client's own home. Support workers therefore usually work in community or home settings to help people with a broader range of tasks, like managing finances or social activities, and as said, becoming more self-sufficient. So, for example, as said, a support worker you might see taking someone to a GP appointment. To become a care worker or personal assistant within the UK, you need to have basic literacy and numeracy skills. This requirement is usually in the form of evidence to level 2. You'll also need to demonstrate you have core qualities such as being able to be empathetic, be respectful, have effective communication skills, and most of all, patience. Most organisations will expect you to have a level 2 diploma in care. For example, the one that you can undertake with South London College, level 2 adult care certificate. Personal assistants may be required to have the level 3 diploma in adult care. So if you're intending to enter a specialised field, for example, dementia care, then a level 2 certificate in the principles of dementia care might be more appropriate. So you need to find out, you need to think about the role that you'd like to undertake and then explore what you need to have to enable you to enter that role. Becoming a support worker, the requirements vary depending on the organisation, but you still need literacy and numeracy skills to level 2 and the same core qualities as for care workers. But it might be useful to have a qualification such as the South London College level 2 adult care mental health awareness course or the level 2 supporting individuals with learning disabilities, because having these types of qualifications will increase your chance of entering a role, particularly if you don't have any practical experience in this. So think about what you need, explore what you need, and do look on the NHS careers site because they have lots of information about the types of roles and the types of organisations you can actually apply to. Could I have the next slide, please, Noah? So here we're looking at specialist and advanced roles. So you might want to focus on specific employment pathways. So additional qualifications will be required for these roles. For example, dementia care, you may need the level 3 certificate in understanding dementia care. To become a mental health support worker, you may need the South London College level 2 adult care mental health awareness course and or level 2 supporting individuals with learning disabilities. If you want to look at, say, palliative care, South London College has a level 3 certificate in the principles of end-of-life care. Supervisors and team leaders, you will definitely need not only practical experience, but you will need probably a level 4 diploma, such as the South London College level 4 diploma in adult care. And if you're looking to go into leadership and management, look at the level 5 leadership and management in adult care course. Now, as you can see, as you go up the ladder in advancement of roles, the requirements for qualifications and experience will also increase. But remember, along with specialist and advanced roles becomes more responsibility and usually a significant increase in salary. So when you're thinking about your action plan, if you like, what you'd like to how you see your career moving, from start, and how you want to progress, try and explore the types of context you want to be working in. Do you want to specialize? If you want to specialize, which area, and what will you need to specialize? If you're looking at eventually becoming a supervisor, a team leader or manager, then think about the types of qualifications and experience you will need. Could we have the next slide, please, Noah? So here we're looking at types of soft skills, and we've already spoken a little bit about empathy and patience, but we'll look at these in a little bit more detail here. So empathy and compassion. So you need to be able to understand a person's feelings, listen to them and act kindly. And this, as we said before, builds trust and helps to facilitate positive outcomes with care delivery. So for example, you may be supporting someone in a care setting, might be in their own home or in a residential setting, and the client or patient may be quite elderly and they're very slow, they don't have good mobility. You may have a lot of tasks to do in your morning, and you may have sort of in your mind allotted specific time for this patient and client, and you may be inside wanting to hurry them along. They may be chatting to you, talking about their family, etc. And your instinct will be, I've got to get this done, I've got to get this done, I've got to get this done. But you've got to slow down, and outwardly you've got to demonstrate that you're empathetic, you listen to them, they're telling you stories, you can encourage them to complete the activities you want them to complete whilst you're listening, so you're demonstrating patience. And you need to remain outwardly calm, because if you demonstrate that you're in a hurry and you've got to get to the next patient, this will transmit to the patient and you will be impacting the quality of their care experience. So it's really important that you have this. So again, patience and resilience. So being patient, not as we've said, means becoming anxious if things are delayed. And you've got to try and work with this. If a client is slow, you can encourage clients or patients. You can say, usually use their first names. Come along, Susie, we need to get you dressed and get you up and in with the other residents. So you can use various techniques, and you will learn this during your training, theoretical and practical. You'll need really, really strong communication skills. So this means being able to communicate not only with patients and clients respectfully, but taking account of their needs and limitations. But you'll also have to communicate with team members and patients' relatives and the wider stakeholder community. So you need to make sure that you can communicate effectively and, practice your communication skills with your family and friends to make sure that you're not overly shy in communicating, that you can answer effectively with empathy, with kindness, and that you choose your words carefully. So these are things that you can practice. Can I have the next slide, please, Noah? So this slide looks at the practical and digital skills. So there's some specific things to note here. So safeguarding adults. Now from the CQC, they say safeguarding adults involves protecting adults over the age of 18 with care and support their needs, protect them from abuse or neglect, enable them to live in safety and promote their well-being. Work collaboratively with your organisation or team to prevent and stop harm, whilst respecting an individual's views, wishes, feelings and beliefs in decision making. Also being able to differentiate between different forms of abuse, such as physical, psychological, financial, modern slavery, etc., and knowing when and how to report your concerns to the relevant authorities. Now, in an adult social care role, you will always have a safeguarding lead. So you will have someone dedicated who you report any concerns to. And if you undertake any of the South London College adult care courses, they will cover safeguarding issues within those courses. But don't be concerned that you will have to take on the responsibility yourself if you have a concern about a client or patient. There will always be a line manager or safeguarding lead who you will report to, and that will be covered within policies of your employment. So, but you need to be aware what safeguarding of adults means. So the skills for care say that health and safety practices involve risk assessments, maintaining a clean and safe environment, implementing infection control measures like hand hygiene, wearing appropriate PPE, providing and using safe equipment, and ensuring you take staff training in areas like fire safety and first aid. Now again, those in-house training, health and safety training, will be provided by your employer. But again, in most adult care courses, these subjects or sub-subjects will be covered in some detail. So you will be prepared. But when you enter a role, you will probably have an induction where all these policies are covered, and you will probably be given a folder where it outlines all these policies, who you report to, what to do if you see a risk, etc. And you'll probably have to undertake yearly CPD in health and safety practices, but that will usually be provided by your employer. So record keeping in all adult social care contexts, you will have to keep records, be they care plans or medication charts, or simply writing if there's been an accident, etc., or even writing a general report when you're handing over. So the Social Care Institute for Excellence suggests that accurate documenting a person's care, support, observations and decisions should be done in a timely, clear and secure manner, ensuring continuity of care, providing legal protection and informing future healthcare decisions. It may be on paper or in a digital format. So for example, within a care plan, dating and timing of entries using clear and legible language and communicating key events, etc. Now your employing organisation will either use paper-based reporting and record keeping, or it will be digital, and you will be provided with training in those areas. But again, if you undertake an adult care course, record keeping always forms part of those courses, because you need to understand, for example, how to fill in a care plan, what to put in a care plan, etc. Use of digital systems, well, they're really a set of tools and services that employing organisations might use, and they support and improve all stages of health. And often the digital systems are shared. So for example, if you think about NHS patients, they can use NHS Care. So instead of having to keep going to their GP to get their results, etc., they can just log into NHS Care. All their letters are there, all their results are there. So that's one digital system that both clinicians can use. They can contact patients via that system, and service users can use. So that's just one type of system. So wherever you work for, GP, NHS, or a care home, they will have their own digital system, even if it's just a computer where you might have to log something. So you'll be trained in these depending on your role.